Today, I'm going to share about the home sleep study. Home sleep study can help you or someone you care about sleep better and improve overall health. We will walk through what the test is and how it works and why it can be a game changer for diagnosing sleep apnea, all in the comfort of your own bed. A home sleep study is basically an at home test to check for obstructive sleep apnea. Instead of spending a night in a sleep lab, you wear a small set of sensors right at home. The data is then reviewed by a board certified sleep specialist. It takes key things like breathing, oxygen levels, heart rate, body position, and snoring. Everything we need to see how well you are sleeping. Here's how a home sleep test compares to traditional sleep lab study. With home test, you sleep in your own bed with just a handful of sensors instead of 20 sensors you have to be attached in the lab study. And it doesn't require any sleeping in a hospital or clinical setting. The home test usually only needs a prescription, and you can get it scheduled within days. While lab referrals can take weeks, oftentimes you have to see some sleep medicine doctor in neurology or pulmonology, which takes a couple of weeks, and then schedule sleep in the lab, which again takes a couple of weeks. And eventually you fail to fall asleep in the lab because that's not your home. Plus, you get to sleep naturally without all those like wires connected to you. Let's talk cost and practical details. Both home and lab studies require a prescription, but the home study is far more affordable, typically about $150 to $300 without insurance. Our office use a home sleep study called LOFTA, LOFTA, and we simply send a link to our patient. They can click it and purchase the home sleep study like the monitor, and now they're under sale, some promotion, and you can get the test with $139 now. The original price is $189. By the way, just to be clear, I'm not the one who's being paid. You are paying to the Lofta home sleep study company. A lab study can run anywhere from $1,000 to $7,000 if you are paying out of pocket. Of course, you will need insurance to pay for that, but you can see the large price gap between them. Our office can evaluate you if you need one and order the home sleep test directly for you, which makes the process straightforward. There's also an exciting new development. In December 2024, the FDA approved Zepbound weight loss medication, approved the Zepbound for treating moderate to severe sleep apnea in adults with obesity, which means in case you fail to get the Zepbound covered by the insurance, despite obesity being in your medical history, maybe we can prove that you have moderate to severe sleep apnea and apply in that path, not through the obesity path. Insurance usually requires a few things to cover it. One example is BMI 30 or higher, a sleep study showing an apnea hypopnea index of 15 or more to prove that this is not just a mild sleep apnea, but this is at least moderate sleep apnea. Apnea hypopnea index means how often the apnea and decrease in the oxygen level happens in an hour. A documentation of diet and activity plan and proof of symptoms are also needed, and which we all can offer in our office. So many of our patients in our clinic, they come here because they fail to get the Zepbound approved, and they want to go through the sleep study And after we collect the sleep study that proved the patient has a moderate sleep apnea, we apply the prior authorization again and get the medicine for them. The sleep study provides the data you need for that approval. So, how does it work from start to finish? First, you meet with your provider. Do you need me? Are you done? I'll be there soon. I will just finish the live in like really five minutes. Anything particular?
He's good, actually.
Okay, yeah, I will. Yeah. First, you meet with your provider, either in person or through telehealth, to see if the test is right for you. We don't recommend it for a general population. We have to have a reason to suspect sleep apnea. Then you receive the test kit delivered to your home. You wear the sensors overnight during your normal sleep. Sensor on your chest and some sensor on the finger. The device records your breathing, oxygen levels, heart rate, position, and snoring. The data uploads automatically, and within 3 to 7 days, a sleep physician reviews it and gives you a full report and treatment plan. For Lofta, which we use in our office, when you register yourself there, you have to select the provider who's gonna be responsible for it and who's gonna be telling you, setting the plan, follow-up plan for you. And for our patients, you can enter my name there. You can find me. You also might be wondering if is a home study as accurate as a lab study. Of course, it's not 100% replacement for the lab study. Lab study, there's reason why they attach 20 sensors here and there and make you sleep in somewhere that's not your home uh, for higher accuracy and higher quality of the result. But studies show it has on the home sleep study has an 80 to 90% correlation with the gold standard test. I'm sorry, I keep getting okay. And a standard left. I'm sorry, I was laughing because of some comments. Uh, and golds. Okay, so 80 to 90% correlation with a gold standard lab-based test for diagnosing not mild, but moderate to severe sleep apnea. And this is pretty practically high enough accuracy and making it a reliable and convenient choice for most patients. The best part is how easy it is. Setup takes just a few minutes with a few simple sensors. You sleep in your own bed, get results back in about 3 to 7 days. And scheduling is quick, no long wait time like the lab sleep study. Who should think about getting tested? People with high blood pressure, diabetes, or obesity are at higher risk. It's also important if you are seeking Z-bound approval because a sleep study is required for the approval. And not only that, loud snoring. And if somebody who can watch you sleeping say, hey, they saw you not breathing here and there when you sleep, or symptoms like daytime tiredness and morning headaches, when you wake up, you don't really feel like you had a good sleep. You feel like, you haven't had any sleep. You're just so tired. And morning headaches are, and also morning headache. These are like strong reasons to get evaluated. So your doctor, when you tell these symptoms to your doctor will estimate the risk of sleep apnea and decides whether you need it or not. To wrap up, home sleep study is a simple, comfortable, and effective way to diagnose sleep apnea and take that first step toward better sleep and better health. If you or someone you know has symptoms, talk to your healthcare provider about getting tested. It's easier than you might think, and it can truly change your life. Thank you so much for watching.